Hi there. Welcome to About Everything, where we discuss topics about anything and everything. Today, we're going to have some serious discussions. We're going to talk about ADHD, which stands for Attention Deficit Hyperactivity Disorder, and it's a cardiovascular disease. What is it? Is there a treaty for these? That's what we're going to talk about. So without any further ado, let's get started. Probably the first question that comes to your mind is, what is ADHD? Well, according to Kids Health, it is a medical condition. A person with ADHD has differences in brain development and brain activity that affect attention, the ability to sit still, and self-control. It can affect a person at different places, such as home, the workplace, school, and even friendships. What are the symptoms of ADHD? An NHS article says that the behavioral problems that come with ADHD can be broken down into two groups: inattentiveness, or difficulty concentrating, and hyperactivity plus impulsiveness. It says that signs are different for kids and teens. Having a short attention span and being easily distracted, forgetting things or appearing to lose them, not being able to listen to or follow directions, and having trouble organizing chores are all signs that a young person has ADHD. When it comes to hyperactivity, these kids and teens often can't wait their turn, act without thinking, talk over other people, experience little or no sense of danger, and do a lot more. When it comes to adults, they are harder to describe. This is mostly because not enough studies have been done on adults with ADHD. Experts say that these signs include not being able to concentrate or set priorities, losing or misplacing things all the time, forgetfulness, mood swings, anger, and a short fuse. Some conditions, like anxiety disorders, depression, and epilepsy in kids and teens, are linked to these signs. But adults have mental disorders, bipolar disorders, and obsessive-compulsive disorders. Another question that comes to mind is, what does the title say about the link between ADHD and the cardiovascular system? Researchers looked at the link between 20 different heart diseases and ADHD in November 2022. They did this by separating ADHD from other known risk factors like type 2 diabetes, obesity, smoking, sleep problems, and mental illnesses. The Swedish researchers from Karolinska Institute and Örebro University got their information from a national registry of more than 1 million people born between 1941 and 1983 who did not already have heart disease. About 37,000 people with ADHD were on the register. 38% of people with ADHD had at least one diagnosis of cardiovascular disease after an average of 11.8 years of follow-up, while only 24% of people without ADHD did. Men were a little more likely to have the link than women. Adults with ADHD have a high chance of having a heart attack, a stroke with bleeding, or a disease affecting the blood vessels in their limbs. The study also found that people with ADHD who also had psychiatric problems, like eating or drug abuse issues, were more likely to get heart disease. The good news is that it was found that stimulants, antidepressants, and anxiety medicines did not raise the risk of heart disease in people with ADHD. What are the long-term effects of ADHD on the cardiovascular system? The JAMA network says that these people are very likely to have high blood pressure. A number of studies have shown that people with ADHD are more likely to have high blood pressure than people who don't have it. The exact reasons for this link are still not fully understood, but it may have something to do with chronic stress, impulsivity, or an overactive sympathetic nervous system. Additionally, people with ADHD may have trouble consistently following their medication schedules. It's important to know that certain medicines, like stimulant drugs, can temporarily raise blood pressure and heart rate. So, not taking your medicine as prescribed or using it incorrectly could have an effect on your blood health. Higher rates of risky behaviors, like smoking cigarettes and abusing drugs, have been seen in these individuals. These behaviors can be harmful to the cardiovascular system and general health. Are you going to ask, is there a way to treat ADHD? Yes, that is a good answer to that. It can be cured with medicine and treatment, but it works best when both are used together. In the same article in the NHS that was mentioned earlier, there are actually 5 medicines that are licensed, and we're going to discuss them one by one. These treatments are actually hard to say, which are methylphenidate, lisdexamfetamine, dexamphetamine, atomoxetine, and guanfacine. These treatments won't get rid of ADHD for good, but they can help people with it focus better, control their impulses, feel calmer, and learn and master new skills. First, let's talk about it. Most of the time, methylphenidate is used to treat ADHD. This drug is a stimulant, which means it raises brain activity. Stimulants work by doing this in parts of the brain that help control behavior and attention. It can be given to kids over 5 years old, teens, and people with ADHD. If you take immediate release pills, you only need to take a small dose 2 or 3 times a day. If you take modified release tablets, you only need to take 1 dose in the morning and it will work all day. The second one is lisdexamfetamine, a drug that affects some parts of the brain. This helps people concentrate, pay attention, and behave less impulsively. This can be given to kids and teens over 5 years old who have ADHD after at least 6 weeks of methylphenidate treatment have not helped. Instead of methylphenidate, it may be the first medicine given to adults, and you will take 1 pill a day. This third one goes to dexamphetamine, which is like lisdexamfetamine and works the same way. It is given to adults, teens, and kids over 5 years old who have ADHD. People usually take dexamphetamine as a pill 2 to 4 times a day, but there is also a solution that can be put in the mouth. The next drug is atomoxetine, which is different from other ADHD drugs in how it works. It's an SNRI, which means it raises the amount of noradrenaline in the brain. Increasing this chemical can help you focus and control your emotions. It does this by sending messages between brain cells. If methylphenidate or lisdexamfetamine can't be used, atomoxetine may be given to adults, teens, and kids over the age of 5. It can also be used for people who have been diagnosed with ADHD. People take it once or twice a day in the form of capsules. Some more dangerous side effects, like suicidal thoughts and liver damage, have also been linked to it. Do keep an eye out for these. Last but not least, guanfacine lowers blood pressure and works on a part of the brain to make it better. If methylphenidate or lisdexamfetamine can't be used, this drug can be given to teens and kids over the age of 5. Adults with ADHD should not be given guanfacine. 1 pill a day, in the morning or evening, is what most people do. Keep in mind that these medicines can cause side effects like feeling tired or worn out, getting headaches, losing your hunger, having trouble sleeping, stomach aches, feeling dizzy, having diarrhea, and having mood swings. Well, that covers up another day of learning. If you like our content, be sure to subscribe for more videos like this. As always, we are about everything.